Hi, I'm Emily, and today I'm going to show you how to use low rate TENS. So first, I'm doing this on a patient who has chronic cervical pain. It's on both sides, but it's not equal amount of pain on each side, so more on one side than the other. And so for this reason, I'll be putting the electrodes in a parallel fashion instead of crossing them. I would first check the patient for contraindications and precautions. So contraindications for this case would be over the carotid sinus if the patient has a pacemaker or is pregnant and it's in proximity, a DVT, or in some cases osteomyelitis. The precautions would be sensation and mentation that's impaired, metal in the area, so I would check for jewelry, earrings, etc., malignant tumors, and skin irritations. So the first thing I would do then is check the skin in the area, look for swelling, bruising, or any open wounds. Then I would take my paperclip and I would check the sensation and mentation. So I would show her dull, this is sharp, and then I would check the entire area and have her repeat what she feels.
Dull, sharp, 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 dull, dull, sharp.
Good. Then I would cleanse the area that is going to be treated. And I'm going along her cervical paraspinals. Then I would apply the electrodes. And I want them to be about 2 inches apart. Or at least 2 inches apart. I would then hook her up to the machine, so these channels will be in parallel. This will be channel 1. These two will be together. Okay. Then I would turn on my machine and I would set the parameters. So in this case, I want a low rate acupuncture-like treatment. So I would have the pulse rate at 2 to 10. I'm going to put it at a 4. And then I'm going to push set and I'm going to change the pulse duration and I'm going to put it to 150. It can be anywhere between 100 and 300 microseconds. I would then tell the patient that she is going to feel some slight tingling and then it's going to turn into a muscle contraction as I raise the intensity. I would then do one side at a time and raise it according to her tolerance. Do you feel anything yet?
Yep, just a tingling.
Just a tingling. Can you tell me when it starts to become more like a muscle contraction?
Yep.
And you can see it's starting to pulse. I would then do the other side. Tell me when you feel something.
Yeah, I feel.
Okay, and tell me when you get a motor contraction.
Okay.
And the other side is starting to pulse. I would then set her on this treatment for 20 to 30 minutes. I'm going to do 20 in this case. And during this treatment, I'm looking for an endogenous opioid release. This can be done every 2 to 3 hours as tolerated, and it can have effects for up to 4 to 5 hours.